I am Wendy Randall. I'm one of the consultant midwives at the John Radcliffe Hospital. I apologise for being a few minutes late, and I'm just hopefully going to be able to answer some of your questions today. So this is the 17th of May, which is very exciting for everyone as we start to enable us to meet people indoors as well. So I just wanted to remind people to still follow the government's guidance to make sure that you're wearing your masks and that, yes, well, we get the opportunity to see and do more things just to make sure that we wear masks and there's still the hand washing, etc. In maternity, we haven't really made any other changes at present. So there's still the visiting times as before, and partners back at scans, etc. And it's just to let you know that at present in maternity, we only have one lift that is working. The men are working incredibly hard to try and get the other lift up and working as well, but there's just one. So please anticipate that there can be delays, especially during the time that the scanning department is open, because only 4 people are allowed in the lift at one time. So obviously trying to get that sorted as soon as possible, but just to make sure that you're aware of that when you come into the service. There is a vaccine trial that's about to start. You'll get some details from your community midwife, so you may be offered to take part in the vaccine trial for COVID and Pfizer vaccine. And the community midwife will share the information with you, and then you can directly contact the researchers if you want to be part of that trial. So I think I've got a few of you now, but I don't know that anybody's necessarily posted any questions just now. Is there any burning questions that you have if you're part of this call? I'm not sure what we have that we can share with you. Hopefully we will be returning to the full set of nice antenatal care, hopefully next month. You'll start to hopefully see your community midwife a lot more. And it is important to remember that if you have any symptoms that you think you may have COVID, or that somebody in your family does, that you follow the guidelines, and please let your community midwife and GP know, especially if you are diagnosed with having a COVID infection. So it's really important that we can do more screening from that perspective. Oh, Shabby has posted hello. Hello, Shabby. That's lovely to that there's somebody out there. Oh gosh, I'm not normally strapped for things to say. What can we talk about today? This is really just to answer your questions that you may have. Not sure. We're hoping to have some resources available soon. I know Maternity Voices have worked very closely so that with us over the last year, so we have made some films, and I gather they've done a bit of ordering of their YouTube site with the films so that you can access things that we did last year. We're also looking at an antenatal platform that will be recording the most up-to-date films, etc., that you may have. Okay. You want me to wear a microphone? You can't hear me. Right, you're going to have to cope with the headset too and see if this makes a difference. Does that help? Alexandra, thank you for pointing that out. I tried not to look like that I have my headphones on. But hopefully you can hear that bit better. So Claire, you have posted a comment that you're suffering with hay fever.
You're 29 weeks pregnant, and what can you take, please? So there are tablets that you can take when you're pregnant if you just check with the pharmacist when you go in. And also in terms of hay fever, they tend to say things like reduce the gluten content in your diet, reduce caffeine, um, unfortunately reduce chocolate, and reduce things like milk and yogurt, dairy as well. There are some acupuncturists that do treatment for hay fever. You can go down that line if you don't want to take tablets. Um, but yeah, those are the kind of things that you can use hopefully to help you. So Jenny, you've asked, can a midwife be hands-on to slow down the birth of your water, the birth of the baby's head if the birth takes place in the water? Yeah, so Jenny, generally it depends on what position that you're most comfortable in when you're in the water. We do have something called Peaches package of care, which is various things that we do to help reduce the chance of you tearing. A lot of that is with us working with you so that the birth of baby's head is nice and slow. Um, but it can be helpful to have our hands on your transverse perineal muscle to take the pressure off of it. So your transverse perineal muscle is, imagine this space is your vagina, this is the perineal body, and so your anus would be down here where you poo from. So this bit of skin here is your perineum, and the muscle runs across it. So by us putting our um, hand on, we can actually dimple and take the pressure off that transverse perineal muscle. So if you were sitting in the pool in an upright position, it would be a bit more difficult for us to pop our hands on because of the pool. If you're on your hands and knees, then we can do it obviously just round from your bottom and put our hands on. We have to obviously be really mindful about our backs, leaning over the pool. But you actually only have to put your hands on when it's for a much shorter period of time and when you see the baby. There is suggestion that you get some counter pressure from the water, which helps with that. And for a lot of women, it's just that really, really slow birthing of your baby's head. So it is possible, but like I said, it depends. We have to be very careful about our backs and moving and handling. And Alexandra, I'm really pleased that it's working better. So sorry for not putting my headphones on before. It's not really. Um, I try to avoid putting my headset on when I can, but I'd much rather you could hear me. Um, so Shabby, um, you've said in the midwife-led unit in the Spires, will you be allowed to bring your partner and your mum because your baby's due the first week of July? So Shabby, currently we still are promoting just one birth partner coming. People during the pandemic have had mums and doulas, etc., available on, um, WhatsApp or um, FaceTime, etc., so that they're still present. Again, it's not a change that we've moved over to at present, and we are mindful that, again, coming back to where we have reduced capacity in terms of the lift. Only having one lift for all of the floors in the maternity unit, and with partners going backwards and forwards, etc., from the postnatal ward. Um, we haven't quite looked into that aspect of things, but who knows? Things change all the time. In maternity, we're very much being guided by what's happening in the trust in general. So they want us to do things together. So we're waiting for a catch up with the chief nurse in terms of what's happening in the general side, so that we can then work out what our next steps are in maternity. So Kim, hello. You've said, what is expected hospital stay for an elective section if everything is straightforward? So in terms of if everything's straightforward, Kim, if you have your cesarean in the morning, we try to get you home the following evening. So it's roughly about 36 hours. But obviously, if you have your cesarean in the afternoon, then you may find that it's a couple of nights in hospital. And obviously, as you've said, it depends how you recover. Uh, and you said you're on fragment injections. Will you be able to have the spinal block epidural for your cesarean? Yes, so when you have your pre-operative appointment, Kim, the anaesthetist will go through that with you in terms of when will be the best time to stop taking your heparin. So Sean, you've asked, are there any plans for visiting restrictions to be relaxed anymore and rules for birth partners before June the 21st now? So Sean, yes, it is absolutely something that we look at on a regular basis. At present, our big drive is to get back to offering the full spectrum of antenatal care for people. So that's what we're focusing on just now. But we have regular meetings to see what are the next steps in terms of what we do. So hopefully we'll have an update and we will share it as widely as we can on each site. But I haven't got anything for you today, I'm afraid. Uh, And Stacey, you're saying, how are you anticipating any further changes to visiting hours or who can visit if you have to stay in hospital over the next few weeks? Again, Stacey, similarly, we have opened up the time, so there's three 3-hour sessions available on level 5, and there's one 3-hour session available on level 6. And again, we have been staggering those because of the impact of only having one lift. So I'm not anticipating any changes this week, and hopefully we'll find out this week. We're literally going on a week by week basis to know what will be the next part of the visiting. Um, Kim, you are most welcome. Um, Shabby, you're saying how effective is the perineal massage with helping to minimise birthing tears? Um, Shabby, the measures that we take in terms of your perineal care, so the massage is about putting moisture and stretch into that tissue, a bit like we advise people to moisturize their bumps, because if the skin is going to stretch, it does so much easier without marking if you can make if you put more oil, etc., into it. So, we believe in perineal massage. It is part of what we advise that you do regularly, and there is a leaflet on our website. Pardon me, and there's also the NCT have something very similar. If you Google that, um, you can see their leaflet as well. But yeah, I think the combination of things, the massage is to enable it to stretch, and then obviously the warm water that we use, either by using a pad, the releasing the pressure, all of those things help to reduce the rate. And since we put in this peaches package that I referred to earlier, we have seen our overall tear rate for the third and fourth degree tears come down from 5.5% to around about 1.5%. So we feel that it's very difficult to say if it's one thing that makes a difference or whether it is the combination of everything, and that greater awareness. But we're doing everything we can to reduce the rate of tearing. Um, Jessica, you're asking, do partners need to wear masks while you're in labour? Yes, Jessica, your partner does have to wear a mask. We ask for you both to wear a mask when you're moving between areas, but actually, Jessica, when you're in labour, you don't need to wear a mask, but your partner does, just like the midwife is. Um, so, Robin, thank you for your kind message. You're under Silver Star, and when it comes to labour, if all the rooms are full, would you then be on a midwifery unit instead? So, Robin, for us, it's about the right people birthing in the right places. Some women are under the care of Silver Star because there are things that they're monitoring for in pregnancy, but can still birth in midwifery led units or at home. And it's something we ask you to look at with your Silver Star doctor. and they'll be able to advise. More often than not, they tend to advise the spires rather than freestanding midwifery led units, but do discuss that with them. But if a woman needs to have labour care and should be on an obstetric unit, we will make sure that she has a room to be able to be on the obstetric unit because that's important. Um, oh, thank you, Lauren. Thank you for the very positive feedback. I'm glad you have confidence. So thank you. Um, And Tracy, you have asked, can partners attend 36-week scans? Absolutely. Yeah. So we're back to normal with partners being able to come for scans. Unfortunately, um, we're not able to have other children there. So I'm afraid plans still need to be made for children. So it's just your partner for scans. Um, Alexandra, you've said if birth is taking very long time, because your friend had quite a long one, 48 hours, well, are partners allowed to go out to eat and come back? You will take snacks, but with more than 24 hours, I assume it will not be enough. So, Alexandra, yes, they can. I mean, we do try to advise that they don't go out and in very often, just because obviously they're there to support you. But clearly, they do need to have a walk and stretch their legs, and obviously be refueled when they come back in. The only time it's different is if you're on the ward. So people that come for postnatal visiting or antenatal visiting on the ward, if partners do leave during that 3 hour window, I'm afraid they're not allowed to come back in. And that's just because, again, of the lifts, going in and out the lifts. But if you're on the spires in labour or you're down on delivery suite in labour, obviously it's a bit different. But to the postnatal ward. Uh, So Zoe, Amy, um, you spoke with us before your son was born in June. Um, because you'd had a traumatic birth, I think, with your first son, who was 10 pounds, 13 ounces. Wow, at 40 plus 4. So you were induced at 38 weeks with son 2, who was still a large baby, at 9 pounds 5. Um, and your can you request to be induced at 38 weeks, third time round, because you're petrified of it being traumatic again? Um, yeah, so Zoe, Amy, I think I remember your name from last time actually. Can you, if you speak to your community midwife, she will arrange for us to have a chat again. And I hope it was although your son was obviously clearly quite large again, I hope you had a positive experience when you had your second son, and hopefully we can do the same again this time round. Uh, so Olga, you've asked why do people drink raspberry leaf tea and is it recommended? You're 33 weeks pregnant. Um, so Olga, it's one of these things that people feel is good for uterine tone, not necessarily for contractions. And I'm not sure I understand the physiology as to why things happen. But it's much like people advise raspberry leaf tea. Some people think pineapples work. Years and years ago, it used to be castor oil, but please don't drink that because all that does is upset your stomach and make you feel very unwell if you were to drink it. Um, I think, it's things that people do that feel that they're doing something positive that can help with the contractions. Some people like reflexology, some people um, like acupuncture. There are different things out there, but there will always be somebody that feels that there was something that they did that made a difference. Raspberry leaf tea won't do you any harm. I'd say it doesn't taste particularly nice either. Um, and I mean, my children are in their late teens and 20 now, so we didn't I tried it too. It tasted horrible. I left it to brew and get really, really strong. And then I used it as the water for Ribena to enable me to drink it because it wasn't a nice taste. But there's probably somebody out there that says that that's not the right thing to do either. It certainly won't do you any harm, Olga. So Rachel, your question is, can breech births be at the spires? So Rachel, the thing with a breech birth is it's really important to know how the baby is, and so we advocate continuous fetal monitoring. I mean, a baby can be born anywhere, breech or head down, but it's about whether that's the safest place for them. We advocate continuous monitoring so that baby can tell us if there's a problem, hopefully before it becomes a bigger problem. So we recommend birthing on the delivery suite with continuous monitoring of baby's heart rate. I mean, I think we're very pro-vaginal breech birth in Oxford, and we try to encourage women to be on their hands and knees and have a more active labour and birth, and discourage women from having epidurals. Because it can take away that natural response in terms of baby descending. But obviously that's, we make recommendations. It's up to you whether you want to accept them or not. If it's something that you want to consider, Rachel, if your baby's breech, I'd really recommend that your midwife refers you to speak to myself or one of my colleagues so that we can just go through the pros and cons with you and enable you to make an informed choice. Bethany, you're due an induction at the end of May. Can you explain some things I should expect as you're a first time mum and you're very nervous? Okay. So Bethany, there's a really helpful, well, I'm hoping it's a helpful film that we made with the induction of labour team. So Denise, Di, and myself made a film that was recorded onto this Facebook page in their YouTube links. So you might find that good in terms of more information. We do predominantly a mechanical induction in Oxford, which means that it's a slower process. It's a two-stage process. So you have the catheter put in the day before we plan for you to be in labour. And in a lot of cases, it's possible to go home with the catheter in. It's a bit uncomfortable, the catheter going in, but once it's in, women are quite positive that it feels comfortable. You go home and then the catheter will either fall out by itself or we will remove it a day later. And at that point, you then have your waters broken. And then after about 4 hours, if you haven't gone into labour by then we'd start a hormone drip to bring on your contractions. But that's a rough process, Bethany. It can be different. Depending on, some people don't need to have the catheter in because their cervix is already very dilated, and they have a stretch and sweep instead and go home to come back the next day. Other people go into labour from having their waters broken, and don't need the hormone drip. So everybody's very different, but we try to say to people, please don't be nervous. We will go through things every step of the way. We won't do anything to you without your consent, and you'll be involved in your decision making in the um, along the way. So we'll talk you through with it then. When the induction of labour team give you the date, they can go through things in more progress again. So just keep asking because we want to make sure that you have all the information, and that you're not nervous, or as much as we can help with that. And then by meeting the induction of labour team, they're really great. We have two amazing MSWs, sorry, maternity support workers there as well, who are very reassuring and talk you through what's happening. So hopefully you'll be less nervous, but yeah, talk to your community midwife. They're an amazing resource as well and can tell you all about it. Oh, thank you for that lovely positive feedback, everyone. Um, so I've got Emily. You're 27 weeks pregnant with your second baby. and you're wondering when VBAC appointments are meant to be, you haven't received an appointment yet. So, Emily, basically what happens is when you've had a previous cesarean section and you book with your community midwife, she will start to have the discussion with you um, about what your plans are for the birth of the baby. And she will go through things generally when you're 16 weeks pregnant. Although I think because of some of the things that happen with 16-week appointments, it may be a little bit later. But she'll talk through with you and discuss what you want to do. Um, if you feel like you need more information to make that decision, then she will refer you to the birth after cesarean clinic. If you think that you'd like to have a cesarean section, then she'd refer you to the birth after cesarean clinic. And we try to see women in that clinic before they're 28 weeks pregnant. So somewhere around 26 to 28 weeks. We've been a bit overrun with appointments lately, so we're a little bit delayed with that. And we're trying to set up community clinics to make that better for people. Um, if you're but if you're planning to have a vaginal birth after cesarean, then the midwife won't necessarily refer you in to us. She will be able to answer your questions and help make plans with you. So you won't need to come to the birth after cesarean clinic. And some women who've had a previous cesarean section want to have a vaginal birth after cesarean, but will want to have it in the community or in the spires. And if that's the case, then they come to see one of the consultant midwives. So myself or Emily Brace or Heidi Otteson, you come to our mode of birth clinic just so that we can explore that with you. In greater detail. So I hope that answers your question. So if you want more information on vaginal birth after cesarean, or your choice is to have a cesarean section, you should have had appointment. You should have had an appointment by now, or at least know of it because you're 27 weeks. So if that's the case, please talk to your community midwife, and we can make sure that that appointment is chased up for you. Uh, Venetia, you're a first-time mum. I'm very new to this. Could you possibly tell me more about whooping cough? Um, so, um, Venetia, I'm probably not the best person to do that. I can tell you, why to have it, why it was there, but actually there is a really good leaflet, and I really think the NHS Choices website is really good for more up-to-date information on it. So do have a look at that. I'm pretty sure your GP has a patient information leaflet about it that you can have a look at, and there may be one on our website. But generally, it is a very good thing to have, and I'm not aware that it makes anyone feel unwell. There may be people on this call today who have had it themselves and may be able to give you some further information. But it's not something that I'm probably the best person to talk to you about. Shabby, you've said in the spires, would you get to choose whether you get a water birth? And if so, how about making arrangements? Is it part of the birth plan, or is it based on availability of the spires rooms? So we basically recommend for the majority of women to use the birthing pool if they can. There's very few reasons why people shouldn't use a pool, but you're right, it does come down to availability. We have 3 rooms in the spires with pools in them, and we generally use those rooms, and generally we have enough rooms for them, even when our birth rate has been much busier than it is now. Um, and if they are all in use, what tends to happen is because women are at various stages of labour, somebody will give birth to enable you to use the pool, and we will just, after the birth, move them into one of our postnatal rooms quite quickly, so that we can get the room cleaned and ready for the next person coming in. We have on occasion sent somebody down to delivery suite because they have one pool there, but it was available, and we didn't. All our 3 pools on the spires were in use, but generally, I'd say that you will be able to have a pool on the spires. Um, and you don't have to make arrangements. You just, obviously, we talk to you when you come in about what you'd want, or you can tell the midwife when she's saying it's time for you to come in to see them. You can say that you want to use the pool and we can get it ready for you. Um, okay, so Emily, you're going to chase up appointment. That's fine. Venetia, I'm really sorry that they haven't given you any information about the vaccine. That's really bad. Venetia, if you can't get it from your community midwife or you can't find it on NHS Choices, then please, if you message Facebook this page, I will find it for you. I'm terribly sorry. I'm not so good at that aspect of things. Um, but Alexandra kindly has shared for you some information from when she just had the vaccine. So I think after it was a bit of a slow start for us today with me finally getting around to answer your questions, and I'm glad I will wear my headphones next time so you can hear me much better. Um, I'm, you know, please share this site with as many people as possible because there are lots and lots of films. We have made a lot of films that are saved on their YouTube channel that I don't think they'll have gone out of date that much for you to be able to see. And we look forward to seeing you when you come in. These are just short sessions for me now, so I'm going to leave you for the day. And if you do have any burning questions that you can't speak to your community midwife about, do message Maternity Voices Partnership, and they will get in touch with me. So it's a very one-way conversation, but thank you, and thank you for your positivity in the chat box. That was very lovely. Thank you. Bye bye.